We are live and all set to go.
Okay, it's 6 o'clock. We'll call the meeting of the Board of Health for May 11th, 2021, the town of Northborough. And we'll begin with some legalese. Kristen Black.
Hi, this is Kristen Black, health agent for the town of Northborough. I'm just going to read a simple statement about this remote meeting. So this meeting of the Northborough Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, the town of Northborough has been advised and directed by the Commonwealth to suspend public gatherings. And as such, the governor's order suspends the requirements of the open meeting law to have all meetings in a publicly accessible physical location. All members of the Northborough Board of Health are allowed and encouraged to participate, all members of the public allowed to encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed in the agenda. Ensuring access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So I will hand it back to the chair so you can go through your roll call with the simple statement of when you call their name to respond in the affirmative. Thank you.
Okay, when I call your name, please respond in the affirmative. Dilip Jain,
Present.
good evening.
Good evening.
Swati Sane,
Present.
good evening.
Good evening. Good to see you all.
And we also have Teresa Capabianco
Present.
coming to us remotely.
Remote, for sure.
Welcome.
Thank you.
Thank you for being here. Okay, so I'll turn it back over to the health agent, Ms. Black, and lead us through the beginning of the meeting, please. Actually, has everybody read the meeting minutes from April 13th?
Yes,
Any problems, Dr. Jain?
I don't see any issues with the meeting from April 13th.
Dr. Sane
No problems.
and Attorney Capabianco?
I wasn't present at that meeting. I reviewed
Oh,
them. I
that's
didn't
true.
see any issue with them, but I wasn't there, so.
Okay, well, I've read them and I have no objections to them as written. The chair will entertain a motion from one of the board members to approve the meeting minutes from April 13th, 2021.
I make a motion that we approve the meetings as recorded for the Board of Health for April 13th, 2021.
I second that. All those in favor?
Aye. In favor.
Dr. Sane, Dr. Jain,
I in favor.
and I in favor as well. Approved as recorded. Now, health agent Kristen Black will lead us into the COVID-19 update, please.
Okay, so I'm going to share my screen. I just put together a brief presentation. Bear with me a minute. Is everybody able to see this okay? You can see my screen. So I
Yeah.
just want to
Yes.
cover case counts briefly. So a big thank you to Andy Dowd, our fabulous town clerk, who has taken over sort of helping to push this out every week while I've been distracted with vaccine clinics. So overall, you know, this data on this case graphic is updated each week on sometime between Thursday and Saturday morning. This data is pulled from the state weekly report. The good news to report, you know, is we're seeing, you know, nationwide, statewide, we're seeing, you know, the cases have dropped. Our risk level is currently low, and this is off of that states like the state of Massachusetts, you know, the green, red, yellow we're all used to. The total case count since the start of the pandemic, we're just over 1,200. Case count in the last 14 days has really dropped down to 15, even slowed down more this past week. You know, you might remember times when we were well over 100 on that case count, you know, at the peak And our testing positivity has really dropped down to a 1.1%, and we're really seeing this statewide. So some great news on the
Good.
trends of our weekly case count from the state of Massachusetts. Again, that's reported, comes out each Thursday. So what's really exciting to report to all of you is the vaccination data from the state weekly report. So each week, the state of Massachusetts, why this is awkward, the state of Massachusetts pushes out this vaccination data. You can find this report online. I have the hyperlink here. We can upload these slides later. This report came out last Thursday. The report date is the May 16th. The data is current as of May 4th. I just want to draw your attention, this table here, it's a big, huge table, so I just filtered it for some of the most pertinent stats. This is just specific to overall population. So this is broken down into age cohorts. So you could see that first row here is 0 to 19 years, and just really focus on individuals with at least 1 dose per capita. So you could see our 0 to 19-year-old, that number's at 18%, but obviously we have many students who are not yet eligible for the vaccine. But as you go through the other cohorts, age cohorts, you can see our numbers are fabulous. So overall, the town of Northborough, we have a 74% individuals with 1 dose per capita. And even when you get to this last column here for fully vaccinated, being 2 weeks after a 2-dose regime like Pfizer or Moderna, or 2 weeks after the 1-dose Johnson & Johnson shot, we're at 50% for our community. So the good news in Massachusetts is we're seeing most people go back for their 2nd dose. So I would expect everything in that far right column is going to creep up and hopefully be very darn close to the 1 dose per capita. It's just a matter of time. So again, our numbers look really good. We overall, our seniors 75 and older, our seniors 65 to 74 years old, they have over 95% are fully vaccinated, and you can just see the numbers here, even very impressive, the 30 to 49 year category, 93%. So the numbers look really good, and we want to talk about the good stuff. So we lead the state in vaccination.
Wow.
According to this week's report, when you filter for communities I don't know why this is shifting. When you look at communities for over 10,000 population, we are number 1 this week at that 74% rate.
Whoa.
I'd like to say we could
That's
all
really
take the
good.
effort, but
Nice.
this was one, we have a community that is very educated and has great resources and access and good medical information. And so other communities where health departments have worked just as hard or harder have much lower rates. So it's definitely, it's about the community. And so great job to everybody. Thanks for believing in the
Wow.
vaccine and in making our community safe. So in Worcester County, we've ranked for the last few weeks, we ranked just number 1 overall. And then we rank number 2 in Worcester County for fully vaccinated individuals per capita with that 49%. So we do have some communities, like small communities on the islands of West Tisbury, for
Right.
example. They have like over 90% vaccination rate on that first dose, but they don't have a lot of children in that area. So again, overall, Massachusetts is leading the country, and Northborough is leading the state. So real exciting news.
All right.
Wow, that's
Excellent.
great news.
Excellent. Thank you. Wonderful.
Welcome. So I'm going to transition real quickly and just give you a quick update on our regional vaccination clinic. So again, for everybody, this is a cooperative project with health and fire departments from 7 surrounding communities of Ashland, Boylston, Holliston, Hopkinton, Southborough, Westborough, and Northborough. So last week we saw appointment. We've been running this clinic. This marks our 5th week, but we did really see a drop off in appointments last week. And we saw that drop in demand. We were consistently booking 500 appointments a day. And last week, we had 400 on the Wednesday, or almost 400. It just dropped. So you can see those numbers at the very bottom. We dropped to 123, 187. This was a trend we saw statewide as supply is finally starting to outpace demand, which is a good problem to have in terms of what we have the supply. But now there's really that hard work, boots on the ground, talk to your neighbor, give people good medical sources of information to really help to improve vaccination rates and get those people that maybe are on the fence or we're just waiting patiently, they're placed in line, but we want to let them know your place in line is there. We have the vaccine. There's plenty of access at our local site or many other locations like pharmacies, et cetera. I believe Northborough CVS is now offering Moderna. So really
Good.
encourage people to go where you're comfortable. Doctors' offices still don't have vaccine for the most part. They should be getting it, but lots of choices. So we're offering here at our regional site, Moderna appointments Wednesdays through Fridays from about 9 a.m. to 2 p.m. We're getting into our second dose clinics, but we are overlaying that and have availability of first dose clinics. And then Saturday was a real success story. We ran our high school Pfizer clinic. We were really targeting those 16 and 17-year-olds who are eligible for Pfizer, but not Moderna. And while we vaccinated, close to 700 or so, 570 of those who were vaccinated were 16 or 17 years old. So it was a young clinic. It was really fun to see all these kids out there with families and even able to vaccinate, a mom or dad that was with them that maybe hadn't had a chance to get the shot, and make it convenient and let them come in. And due to that drop in demand, we have been offering and advertising walk-in appointments. So if anybody ever has a question, please call the health department. Angie and Katie are our scheduling gurus. They answer the phone and have patiently helped, I'd say hundreds at this point, of people register. So again, we're happy to help you get wherever it's convenient for you and help you with that process. So this week's schedule, so again, as I noted, it marks our 5th week of operation. And given we're running the Moderna vaccine, that means everybody that we vaccinated on our first week is now coming back for their second dose clinic. And we are just running the clinics this week on Wednesday and Thursday because there was a conflict with the hotel on Friday that we knew about. Next week, though, we're going to ramp it up and we'll have 4 days of vaccinations on Monday, Wednesday, Thursday, and Friday. So just a little bit more on our overview of our site stats. We've delivered nearly 6,000 doses since we opened the clinic a month ago. Mostly those were first doses. We have offered the convenience feature for people who didn't want to maybe go so far away for their second dose. They could come here locally, or just individuals that had to cancel appointment and needed help. So overall, we're doing great. And we have some more stats here, just talking about, again, our no-show rate is around 2.6%. We are seeing higher rates of cancellation because people are vaccine shopping. They might be making an appointment at one site or location and then saying, actually, my work schedule, they have that flexibility to book. So important thing is shots in arms, and we're seeing a great booking rate for those second dose appointments, which has been great to see people are scheduling those and are really coming back. So again, this on the spot appointments, these are some of our walk-ins that we're accommodating. And so there was a lot of news coverage over the weekend with our Saturday clinic. We had coverage with Boston 25, and we had other, local, these links I could share with you. I think I'm not sure if I forwarded you all of these details, but we had a lot of news coverage that you could put on the TV on the weekend. Saturday, they were talking about before the clinic. Sunday, they were wrapping up and talking about the stories and interviewing families as to why they were choosing to vaccinate their kids. And NPR also interviewed many of these students. And we're going to, I understand that story may be airing this week. I don't know if the story, they were going around to multiple vaccine clinics in the area. So I think the story we're really trying to tell is that, families are comfortable, the data's there, talk to your pediatrician if you have concerns. And it was exciting to see these high vaccination rates in town among our 16, 17, and 18-year-olds. And so the big news, if you're following it this week, is that the COVID-19 vaccine for children did receive emergency use authorization from the FDA yesterday. And so everybody said, well, how do I sign up, right? But unfortunately, there is still one more step in there. We are still waiting for CDC, the ACIP, to make a formal recommendation. That meeting is scheduled for tomorrow at noon. And then also the state of Massachusetts Command Center sort of accepts that and goes through their process. And then they need to, most importantly, fix the online registration software that we're using and everybody's using, because right now it's screening and it won't allow anybody to register if you're under 16. So realize for people, I know there is FDA emergency use authorization approval, but there's a few more steps. We anticipate it will be by the end of the week. I'm hoping tomorrow. We do have a Pfizer clinic planned for Thursday. So that is coming. So again, here is our plans for our regional clinics that are geared at this 12 to 15-year-olds. These individuals have not had options for vaccination. So there's going to be probably a big boom of interest. It's 4 age cohorts. And so, oops, I jumped ahead. So again, we will, the registration, we have it, will be on the website. It's circulated directly through the schools. Anybody is really welcome. These are public clinics. We're going to offer about 1,500 Pfizer appointments over this week and next, and we're targeting that afternoon, after school hours. So hopefully it works well for families to, pick a date, pick your kids up, get them off the bus and come on over and get soccer on Wednesday. Then maybe there's another date here that works for you. Depending
Yeah.
on demand, we will likely continue to offer these first dose Pfizer clinics for the coming weeks. But we really, encourage people to register as soon as it's available because there's not a lot of clinics offering Pfizer shots right now. And so there will be there'll be a lot of demand in the first couple of weeks. And to sort of fly along here, we are sort of phasing out and talking about closing our DoubleTree site. We didn't buy the
Yeah.
hotel forever, and we are renting it. And so we originally had set up that contract through July, but just given that huge drop in demand we saw for just really first dose for, our 16 and older, we anticipate that our need will be met locally and more pharmacies have the vaccine available. So again, we'll be looking at running our first dose clinics will for Moderna, the last day of first dose clinics will be May 28th. And the last date of Pfizer first dose appointments will be June 4th. That way we can still accommodate anybody we vaccinate for through the second dose. So we are thoughtfully considering how we're scheduling things to best use everybody's time.
Right?
So again, we are staffing mostly with fire department staff from that 8 to 2 first dose clinic. And as we're moving into these new Pfizer afternoons, we've really done a big push for volunteers through our medical reserve corps. We're also using some contracted nurses through SAM and VNA. Some school nurses have stepped up and it's really robust volunteer workforce. And that's been exciting to see that come together. So a lot of my time it's a whole new staffing model for these afternoon clinics. And, the firefighters it's a long day to stay from 8 to 2 and then vaccinate that next group all the way till 6 p.m. So we do sort of have 2 pools of vaccinators and that's really been taking a lot of all of the region's time and just planning for those. But it's this is our last push, for the next 2-3 weeks. So I don't know, before we get into public health excellence, Mr. Chair, if you guys had any questions about the clinics or vaccination numbers or anything else.
Kristen, can you send these slides? I will need for the registration because I've already have a lot of parents asking.
Yes, most definitely. Yeah, Dr. Sane. So we are working, all that information will be pushed through the schools, but it is open to students and families and other communities as well. So we'll definitely get it off. But yeah, we're looking, this is a regional site and the state of Massachusetts is generous enough to supply us all of this vaccine, but we do vaccinate the public as well. So we won't discriminate if you're from Shrewsbury or Grafton or wherever you're from. So I'm happy to share that with you. We're just really waiting to push out the link. I mean, the link's there, but if you try to register, you can't. And that's really just the artifact. The appointments are even loaded, but you just can't get to them because of the restriction on the registration software on the age. So I'm going to hold off on getting that to families because that will cause a lot of confusion until the state releases that. And right now we've been strongly discouraged from registering individuals and definitely from vaccinating them. I think we've heard of some pharmacies are already vaccinating that age group. The state is strongly discouraging and they don't want us to skip the approval step, but I will get that to you and I'm hoping it could be as soon as tomorrow afternoon.
Okay. Well, that was very thorough. I don't have any questions.
Yeah, it's just
This is amazing.
kudos to the town of Northborough
Yeah,
all the way around.
you really did
For-
a number.
Yeah.
Spearheading
Well done,
this task
Kristen.
and rating high. I mean, that's just unbelievable.
Yeah. Well, it's believable.
Well, it's believable. Yeah, I mean, we see how hard Kristen and the team has worked. So
No, it did a
Yeah.
lot of work.
Yeah.
It's
they did
really
a lot of
amazing.
work.
It is amazing. It's remarkable.
I
Yes.
appreciate it. And I think, the story to be told too, I mean, I know we were celebrating and then I heard about a recent death in town associated with COVID, so
Really?
it hasn't gone away.
No.
And so it's real important we, keep in mind, and we are starting to see breakthrough. I know I don't want to be Debbie Downer. That was our celebration, but we are starting to see breakthrough cases. So, it's something that people need to be aware of. And, don't think because you're vaccinated, the symptoms are obviously, it has to be allergies, it can't be COVID, so we encourage
Right.
people to continue to really follow those, everything we've done with hand washing, social distancing, testing, if you're symptomatic, all of those things are really important. Across the board, we're starting to see more breakthrough cases. And those are reported to the state and we are tracking it and the state is running samples to see if it's this strain or that. And they're working with CDC, but it's something we're keeping a close eye on.
Oh, no. Jeez.
Well, even the state positivity rate today had dropped down to 1.3%.
Yeah.
So, that's what was released today. So that's pretty good. They had no deaths in the last 24 hours in the state of Massachusetts.
Wow.
Or no deaths, 0 deaths. There were 472 new cases in the last 24 hours. So, the numbers have drastically gone down, and that's why, all the big cities are looking at reopening, ramping up the reopening, with all the things. So I'm not really sure how that's going to take place. And of course, with the variants, that's another issue. So we'll have to wait and see.
So I
Great.
can, if you're ready, I can jump in, show slides and talk about our next agenda item, Mr. Chair, is the Public Health Excellence Grant.
You mean the Public Health Excellent Grant Program for Shared Services?
You got it.
Let's move on to that. I'd love to hear about it.
All right. So I think I forwarded all of you this update. Hold on, bear with me a minute. This update that on April 30th, the town received notification from the Mass Department of Public Health that we were awarded a regional grant for public health services, and the amount of this award is $300,000 per year. So I should know our budget better, but I know our budget is just around $200,000 a year for the whole health department. And so to all of a sudden receive a $300,000 grant in a year, again, shared with 4 communities, but we're going to really be able to offer more public health services to our residents, and really no tax dollars, and this funding did come through the state. It's over $10 million being awarded over 3 years. And there were 29 awardees, in, several in our area, but excited to report this. Again, this is for shared public health services. They're the communities of Northborough, Southborough, Westborough, and Boylston. The grant required that at least 3, the grant required that a minimum of 3 towns were involved. So we are here at 4. So we're really maximizing this large grant amount for just 4 communities. You'll see some of the other grant awardees, may have 10 plus towns. So we should get a lot of bang for a buck. Northborough is the lead agency on this grant, and really the big services that we're getting out of it is that our health inspector position in town, which has typically been 7 hours, is going to go up to 32 hours per week. And that individual will provide routine food and housing inspections for the towns of Northborough, Southborough, and Boylston. Westborough is pretty well staffed for inspectors, so they didn't need those services. But all 4 communities will be sharing 1.5 full-time equivalent contracted nurses to assist with various public health nursing services in our communities. And there'll really be the flexibility for each community to really adapt that person's time in their town to meet their needs. So, I'm in conversations with our senior center staff, which are really excited to have office hours with our public health nurse to provide those resources to residents. And also other work we're doing, everything from like disease surveillance data, education with the public, emergency preparedness. So we are working on the process of really exactly what those nurses will do. And lastly, that the grant pays for food and housing inspection software for all 4 communities. This is something I had originally, had a placeholder in our town budget, but because of the development of this grant, something that, we were able to include under this grant. And again, it's for 3 years. So it's going to be a big improvement to public health services. And so, really, now it gets down to the hard work. We're still waiting for the big formal package from the Mass Department of Public Health and signing everything and all the rest. But what I can tell you is that, we have CMRPC. So again, that's our Central Massachusetts Regional Planning Commission is helping us over the months of May and June. And in doing so, that they will help us to develop both the intermunicipal agreement, or IMA, and as well as develop the scope of services for nursing. So really the next steps, this process will include, determining a governance structure, or a board or advisory that would, help to inform this group and to make sure all stakeholders have, an equal seat at the table and can help to develop it. And so we're working through these. So no formal document is available. Town council will be involved. A member of the town's the town administrator's office will be involved. But really, so the work now is just development. So I guess where we are, we had our first kickoff meeting on Monday with the towns, and now those meetings will held weekly. It's looking like right now they're Mondays. I think it was 11 a.m. where we all met. It would be a weekly meeting. And we would love to have a Board of Health member, hopefully one that would be interested in attending these meetings no more than an hour, just because it's really important for you as Board of Health members and for all the communities to really understand the development of this, that you have a voice as we talk about these options to make sure, none of this will take away your authority or change how you vote or your ability to enact local regulations. But there's other things that we want to make sure you have a seat at the table. So one thing I'm hoping, and I sort of have a question mark here, that whether or not there'd be any motion or interest or availability from any of the members to serve as a representative of the Board of Health on these weekly meetings with CMRPC to develop this intermunicipal agreement.
How many meetings do you anticipate?
One meeting a week is what we're planning for just May and June. So I know it is a commitment, but it's about 1 hour each week.
Does it have to be the same board member?
It doesn't. It might be preferable just for consistency, just so you can sort of understand the development week to week. But if you have scheduling conflicts and you're going away, and again, this doesn't necessarily need to be extremely formal. So whatever works for all of you.
What
And
time
is
will these
the Northborough?
meetings?
Sorry, Dr. Sani. So the times, it looks like it's Monday at 11 a.m. That's what we sort of set for this week. But if there, I think the group is open to, exploring other times that works as we develop the members on this working group.
And Kristen, where's the meeting held?
It's all Zoom.
Oh, it's all via Zoom.
Mhm.
It might be preferable if we had some sort of calendar. I know you want the same consistent person all the way through, but I know myself, my schedule changes on Mondays, and sometimes I'm available, sometimes I'm not, even on that short period of eight weeks in a row.
Mhm.
So if we could get a schedule, like a calendar, and circulate between the board, then maybe we can at least fill all the positions. Well, we'll always have a representative there.
Yeah, I like that idea. I could do a sign up, but
Yeah, that's what I mean, something like that.
Yeah, I could do probably, 4 of those meetings, maybe more. I mean, I'll be
Okay.
talking to my, team manager and, let him know that, hey, this is a volunteer opportunity for me. 11 to 12 on Monday. I'm going to assume it's going to be 1 hour each week for the next 8 weeks or so until end of June. So
Right.
I mean, I would be able to do that. But I'll confirm that tomorrow and I can send you an email then, Kristen.
okay.
Yeah, and we can coordinate it through. Even if we have 2 people there. Since Northborough leads everything, we might as well have extra people.
Except if it's a quorum, then we can't do that. So, yeah. Yeah. But no, what I can do, Dr. Jane, if it works for the board members, what I could do is you could plug it into a little schedule or let me know, and then we could maybe throw the other dates out. And that
Sure.
would be great,
Sure.
I think there is some advantage of having multiple members, just so you can understand the process and the players that are there. Really what it will mean, it's the development of this intermunicipal agreement and nursing scope of services. And then the goal is that we'd be ready to execute those documents or put the scope of services out, and the anticipated start date of really hiring these individuals, increasing the health inspector's hours, is really like, it's all short timelines. It's a July 1, and then we'll be running. And there will be future Board of Health member involvement based on the outcome of that document and the governance structure. So you'll probably have a seat at the table, appointing a board member to serve in that capacity. But it looks like the original proposal that they would be meeting quarterly, once this advisory or whatever group comes out of that governance structure. So it's really just intense amount of time just to get everything set up.
All right. Well, I think we'll be able to come up with filling those slots, those periods.
Great. So I don't think we need an official motion or anything. It was just that's
Good.
perfect. And Dr. James, you can follow up with me, and then we'll kick out the other available dates if that works for
Right.
all of you. And
Yeah,
you can let me know if you can fill those in.
sure.
Thank you. And that's
As long
all
as long as we think there's going to be someone there,
Yep.
if the board has the Zoom click on, the Zoom information. You know, if I'm sitting around doing nothing and Dr. Jane's supposed to be there, I could always click in and say, hey.
Yeah.
Make sure you guys are doing what you're supposed to be. So Kristen, what's the next thing on your, you know, your schedule? You're killing it.
No, I don't
What
know.
else do you
Yeah.
have in mind?
No, right time, right place. You know, one thing where it's end of the year planning, right? Our fiscal
Yeah.
year is wrapping up. I'm trying to scrap together some funds with the building department to really get Katie and Angie excited. And you know what that takes is a full-size scanner would really transform our lives.
Oh,
So
Yeah.
we have a lot of calls from the public and, you know, and I see Katie and Angie, they're on their phones trying to take photos because they don't have time to run downstairs to the scanner. So we're trying to make some improvements to the office to start digitizing our files. I think everybody really wants that. And I think it would
Right.
become, anyway, that's a goal I think we all share and hopefully it will end up with a lighter workload for Katie and Angie.
Yep.
If we are, town hall is officially open. Katie, do I have the date right? May 17th? Okay, so May 17th, we are open at town hall. If you come by to visit us, you can see our door to the health department, building department office has been modified. Some nice carpentry work and they removed a window and it's like a sliding surface window. So we're not going to let you in. We're going to talk to you through a plexiglass. So, anyways, there's some changes there, but we're moving office furniture around. We're adding another workstation, and some of those changes are taking place. So the town's, you know, put up signage, and we're really gearing up for the public to come. But again, still encouraging everybody to file electronically, continue to do things remotely. All visits to town hall, we're going to encourage everybody to, if you need to visit town hall, really limit those visits to under 15 minutes so we don't have to get into a contact tracing nightmare. Right? I
Right.
don't even have to take your name and info, stay 6 feet away. Let's limit it to 15 minutes. Although I know we haven't seen faces of people for a while and people love to catch up, but we're going to slowly transition into this ability to open town hall and offer some in-person services, but they'll be limited to start.
Good.
And Glenn, may I ask you a question?
Sure.
Kristen, do you anticipate that public meetings will be held in person anytime soon?
I think I haven't heard one way or another. I think we hear, some boards can't wait. And some boards, really like the remote and don't want to go back for work reasons or whatever it might be. And then I've heard the discussions about, well, a modified format, but there's a whole technology nightmare, right? I think we've all been on Zooms where you have like 2 people in a room you can't hear or see. So I don't know yet. I don't think the state's gone one way or another, but I do know, I think the public overall is getting sort of fond of this, right? It's
Yeah.
sort of fun to watch a
Oh, yeah.
meeting in your jammies and feel like you're part of it. So more to come. I haven't heard one way or another.
Okay, thanks.
I like the Zoom.
Yeah, so
Yeah.
do you
And re-
prefer the Zoom? I mean,
I
if we get to a point of a choice, I wasn't here before Zoom in this board, but are you all supportive if we end up with a choice or pushing one way or another? Would you prefer to continue on Zoom?
I prefer the Zoom myself.
I'm fine with Zoom for this board. Yep.
I'm okay with even alternating, like we do sometimes at work, one in person and one on Zoom.
Oh, never mind, Doctor. What about you, Dr. J?
I could go either way.
Yeah.
I
Well,
could go either way. I don't mind Zoom. I do so much Zoom and Teams right now.
yeah,
It's all video conferencing, video meetings anyway, so.
Yep.
And the best part is you can do it on your phone. You can do it while you're in your car.
right.
You can do it from anywhere. You don't, if you can't make it in for whatever reason, but you can still participate in those things. And
Yeah.
that's what
Right.
makes remote, there's very little reason for you not to attend the meeting
Right.
considering it's remote. I mean, unless you happen to be traveling or away someplace or whatever. So it gives us that flexibility to be able to still participate.
Right. Yes. Okay, well, I have nothing further myself. Does Dr. Jane, anything further?
No, I'm just thrilled about those numbers.
Yeah,
I
fantastic.
knew we were doing good. I mean, all the numbers you keep presenting the last few months, we were always been good, but to maintain it at that high level, and that's a huge, this thing for us. So, I think it's there, and that's a good thing. And I suspect we'll be doing well with the 12 to 15-year-olds once that becomes official. I'm
Right.
sure we'll do very well with that. I guess my only question was, so for the 12 to 15, it's going to be open to anybody, right? Not just the 4 towns or 7 towns. It's going to be anyone that's around can get it, right?
Yeah.
Did we ever think about possibly maybe going to the middle schools, because that's the 12 to 15-year-olds, right? And running the clinics there. Like, I remember growing up, that's when they used to come and give you the shots or the TB testing in school. You didn't have to go to your doctor's office to do it. Was there any thoughts to some of that possibly, if that becomes approved?
Yeah, I think there definitely is the thought. We were sort of going for the low hanging fruit, right? Like, so we were thinking about that, and you got 7 towns, and we all took all of our supplies and resources and we brought it to the hotel. So we have signage and sharps,
Yeah.
like, so we're all there. And so our thought was, we'll do the easy, quick, low hanging fruit, right? We'll try to get the people that really want it. We have pretty
Yep.
good access to transportation for our residents. We'll start there. And then the thought is then to put the survey out through the schools for saying, like, if you haven't been vaccinated, would you be interested? So, because I think a lot of parents want to take their children, right? Like, I think in that age category, they want to be with their child when they're being vaccinated.
Yeah.
And so either way, they'd be coming to the school or getting in the car with their
Okay.
child. So, but we will consider that. So although we're talking about closing the site at the end of June, we have the total flexibility, the ability to order vaccine, the ability to do satellite clinics. So I think, our goal was to run this and then do a survey with the schools to say, what are your barriers to vaccination, right? Like, is it public health concerns, information, are you vaccine safety? And then for those that are on the fence, if we held a clinic, would you be likely to come? And then probably even surveying, like, what is your preferred day, right? Would it be an after school hour? Or, with people, would they prefer a Saturday morning clinic? So I think we'll definitely do that push, definitely between now and September. But I would think even in the next month or so, we have that availability, but we're trying to whittle down the numbers. So if we do need to run that clinic, maybe it's 30 people and we can go in with 3 nurses and do it in an hour and we're in and out of there. So
Okay.
definitely have that ability. Haven't forgot about that.
Before they escape for the summer.
Yeah,
Like, while
exactly.
they're all there.
That's exactly the point. Exactly, before they escape.
Before they escape.
And hopefully the primary care offices will get some doses.
Yeah, that's a tough
And-
one.
Yeah.
Yeah.
So,
One
And I
more
think
thing.
there's some people that you could offer them everything. They want to go to their doctor's office because that's
Right.
where they've always gone
Yep.
for vaccinations. So I think until those doctor's offices come online, some people are just going to prefer to wait, right? But we'll try every method we have.
Yep.
Okay. Attorney Capabianco, anything from you? Any other further last statements?
No, I would just say thank you to Kristen and, the rest of the board and to the fire department and the town administration for putting these clinics together. Since the beginning, it's been such a huge achievement and the numbers are fantastic. And I'm super proud to be part of this board and
Yeah.
part of those numbers. Well done, Kristen.
Excellent, excellent. All right, well, with that in mind, we'll establish a tentative future meeting date, perhaps June 8th, 2021,
Okay.
via Zoom. Okay,
Sounds good.
well, anything else, Ms. Black? You're ready to go.
Good.
Good,
All right.
all right, well, the chair will entertain a motion to adjourn the meeting.
So moved.
All those in favor?
Oh, we got to
Aye.
second it.
Oh, we got to
Second.
second it.
I second it.
All right. All those in favor?